All righty. Good afternoon, everybody, or good evening. I'd like to call the BPAC meeting for March 10th, 2021 into order. And good afternoon again. So going through our agenda here, it looks like mainly it's status reports to address, but we do have a couple items here, starting with members' interest. If anyone has anything to share for the greater good of the group, now's the time to share. Then we'll roll into public comment if anyone's waiting. So I'll pause here for a minute for any members' interests or any discussion there. Okay. Hearing none, we can, oh, go ahead, I'm sorry.
Hi, Jonathan. Sorry, this is Allie. Can you hear me all right?
Yes, we can, thank you.
Wonderful. So I just wanted to share a concern that came up in my office. I work in South Tampa, south of Gandy, for the health department, as you're all aware, and we have the joy of the construction along Gandy as they work on improvements to the Selman. And one of the issues that's come up is the concern for pedestrian and bike safety along that route. Raised by another colleague that it's difficult to turn onto Manhattan. Our office is off of Manhattan, and there's a lot of concern about hitting pedestrians who are crossing at that intersection and crossing mid-block between Manhattan and Dale Mabry. So I don't know what opportunity this committee has to take that concern back, but I did want to just share that since it was brought to my attention.
All right, thank you, Allie. I think, Wade, that kind of falls in between interests and public comment as well, and we can bring it up through staff, right?
Yes, sir, and Mr. Henry is on the line. I'm sure he's taking note of this, but we will follow up on that as well.
Yep, I've got it. The project's being managed by the Tampa Hillsborough Expressway Authority, but we can definitely circle back around with them and make sure that anything is addressed.
All right, thank you, Alex. Allie, you good there?
I'm all set, thank you.
Okay, thank you. So moving on here, somehow I lost my screen. Here it is. Is there anybody in public comment here, Wade, waiting for call-in comments or in the chat box? Wade, you may be on mute.
Unless Emily Degatano is here for public comments, I do not believe we have anyone.
Okay. Again, is there anybody here for public comment?
If you are, please type into the chat or the questions box and we will recognize you. Thanks.
Mm-hmm. Alrighty, I think I'll move on here. Next item was the approval of the minutes. And I noted from earlier, we did need to make an adjustment to the approval for the minutes to reflect Mr. Sapper was present during the February BPAC meeting. Was there any other changes that or suggested edits that are needed at this time? Okay, hearing none, I don't think we can vote for the approval of the minutes because we're not an in-person quorum, but we'll just reflect that no changes other than having Mr. Sapper present be reflected here. All right, moving on. Next is status reports here. Are we just going in order, Wade?
Yes, sir, and I will switch the presenter over to Mr. Ramirez. Thanks.
Okay, thank you.
And good evening, everybody. Finally got to present this since I've been wanting to do this for a whole year already. Okay, like everybody knows, my name is Diane. Well, most of you know. My name is Diana Ramirez, and I'm with Hillsborough County Public Works, and I'm the manager. Oh, show my screen. Sorry, I hasn't. Oof. Thank you, Wade. And with the Hillsborough County Public Works and the School Route Safety Program. The county is not calling it Safe Routes to School anymore. We're calling it School Route Safety. So you guys just please take a note of that. This evening, I'm going to share with you information that provides a picture of what the county is doing right now for improving safety for our students. I like to start the presentation with a quote from Dr. Leonard Sweet. The future is not something we enter, the future is something we create. Please ponder on this while we progress through the presentation. This is the outline I'll be sharing with you today, of the stuff I'll be sharing with you today, and it includes what prompted the need to revamp the school route safety program, what is and how was the prioritization methodology done, and what is and how was the project development process done, and what is next. What prompted the need to revamp the school route safety program? As most of you already know, the county has a system that to receive and manage customer requests. For the school safety request, most of this process has been responsive. It's been a responsive one. This means that when the county receives a request related to student safety, the county goes, investigates the issue, and then, if feasible, implements improvements as soon as possible to resolve it. The community requests for student safety needs have considerably, and I'm saying considerably, emphasizing, increased since since two policies took in effect. The first policy change was in 2017 when courtesy busing was removed for all students that no longer met hazardous walking conditions within the 2-mile walking distance as defined by Florida statute. And the second one, let me move this here, see if I can. The second was in 2018 when the new belt changes were implemented. Why are these two changes so significant, and why did they cause so much change so much increase into the concerns reported to the county? As it is expected, reducing the courtesy busing service increase the number of students walking to school, and the belt changes resulted in elementary students walking to school during those hours in winter time. And not only the elementary school students were affected, but this also impacted the middle and high school students who walk early to school for breakfast or other needs. Oh, let me see. Okay. After these two changes took effect, it was evident that the school route safety program needed a new direction. And in an effort for the county to keep students safe, the county decided to take a more proactive stand. As I mentioned before, the school route safety program was mostly a responsive one. Now we added a proactive component, which includes a prioritization methodology and a project development process. The prioritization methodology is a data-driven process. Let's see what prioritization methodology and project development are about. The prioritization methodology includes 3 main steps: determining the inventory, prioritizing the inventory, and resolving the overlap of the 2-mile attendance areas for the schools. On the inventory, the MPO, in collaboration with the Hillsborough County Schools, did a study in 2018 and created a report named School Safety Study. And you're currently looking at the slide that shows the cover sheet of this report. Thanks to the MPO study, we were able to inventory the schools in a more efficient and effective manner. We use the data from the report, from the school safety report, to inventory and prioritize the schools. And this study identified a total of 268 schools, from which 132 were screened for the school routes safety program. Okay. The prioritization. The prioritization was also based on the school scores from the MPO school safety study. The 132 schools that were screened were also prioritized and using the scores from this study. And the lower the score, the higher the priority the school rank, based on the study, of course. Once these schools were prioritized, they were plotted in GIS with their respective 2-mile attendance radius. And let's see, the next slide will show you. This is when we saw the overlap. When the schools were plotted with their respective areas, the overlap became very clear. Just imagine these 3 squares, each of these rectangles. Each of these rectangles with colors shows the school areas by type: high school, middle, and elementary. Just imagine these these rectangles are semi-transparent and put one on top of each other. It would become like a big dot, right? Nice, colorful dot. The issue could have caused to account for walking routes more than once or even 3 times. Why do these areas overlap? Oh, they overlap because elementary schools feed middle schools and middle schools feed high schools. So by default, they have common areas. How was the overlap resolved? We resolved this overlap by categorizing the schools into primary or secondary. A primary school overlaps the 2-mile attendance radius of the secondary school as much as 85% or more. Once the primary and secondary schools are identified with the 85% overlap, the secondary school are renamed as tag alone. And the primary school is grouped with the tag alone to be studied as one project together. Using this technique gives 3 main advantages. First, eliminates double or triple counting of school routes when identifying areas of individual schools. Second, during planning, shared routes are identified, and therefore these routes can be improved at the same time to benefit more than one school. And third, this way the available dollars are stretched and better used. The project will benefit more than one school, which will require less dollars than if we address each school at a time. The next step is to determine what kind of improvements are needed for each school and for the primary and tag alone as a group. We took the first 3 schools on the prioritized list and worked on creating the project development process. So these were our, we can say, guinea pigs to create this process. These schools were the 3 schools were 2 primary, which and 1 tag alone. The 2 primary were Pierce Middle, which ranked number 1 in the prioritized list, and Little High School, which ranked number 2. The tag alone was Alexander, tagging along with Pierce, Alexander Elementary. These 3 schools are less than 1 mile from each other, and both Little and Pierce areas overlap Alexander's by 100%. This is a very densely populated area with a large number of students walking and rolling to school, and which of course made it a perfect opportunity to carry the implementation of this new process. The project development process required a lot more steps, and I'm not going to name each of these steps. We're going to go through them, but you can see them in this workflow. Let me see. The first step of the project development process was to perform a desktop analysis which consisted of collecting and analyzing GIS and field data. Once the GIS and the field data are collected, they are used to determine which of the routes are high, moderate, or low demand. The current slide shows a layout of the high and moderate demand routes. Red lines show high demand routes and blue lines show moderate demand routes. Now, this new slide shows routes that serve one or more schools. Remember, I mentioned that the routes that serve more than one school. So this study helped us to discover those things, those routes. Blue lines show routes that will serve one school. Green lines show routes that serve 2 schools, and the purple lines show routes that will serve the 3 schools. And so, you know, these are just for the first 3 schools. This is the project development for the first 3 schools. After the routes are identified and categorized, it's time to get more ideas and input from our stakeholders, of course. And for this, we created the process will create an advisory committee for each school. The committee is formed of at least 1 member representing each of the various community groups, as shown in the slide, on the slide. This step is very critical because the community members who serve these areas have the more depth knowledge of issues the issues that we need to resolve. So who knows better than the people who are there day and night or day after day. For our first trial of the process with top 3 schools, we held 2 virtual meetings for each school. The first meeting was held separate for each school. We share findings and receive input and recommendations. However, our second meeting was combined for all 3 schools. At this meeting, we provided updated information and concurrence and additional input from the committee for the high and moderate demand routes, for the overlapping routes, and for the preliminary proposed improvements. After the last advisory committee, a comprehensive field review is performed on the identified routes with the participation of various engineering disciplines from the county and the consultant. The goal for this comprehensive field review is to identify safety needs and their locations and to recommend specific improvements. The recommended improvements are grouped into 3 tiers. Tier 1 are low complexity, easy to implement improvements that can be done in a year or less. And please note that the timelines that I'm providing are based on funds being readily available for the project. If no funding is available, additional time will need to be added accordingly. Tier 2 improvements are moderate complex. Tier 2 improvements are of moderate complexity with minor coordination and requires some level of design. These improvements will take up to 3 years. Tier 3 improvements are of high complexity with major coordination and major impacts and require a much higher level of design. And these improvements will take more than 3 years for design and completion. Well, after all this work is done, it is time for our second approach to the community, or phase 2 community outreach. This time, the main goal for the outreach is to include the entire community, residents, schools, parents, and community at large, and community groups. At this event, we share and inform about the proposed improvements and also inquire for additional input on the proposed project. The community engagement phase 2 for these first 3 schools was done virtually last December. Now, this flowchart shows a summary of the different stages it takes to implement this new process for the school's route safety program. it shows what have been done in green, where are we now, and where we're heading. The orange is where we are, and the blue is where we're heading, what's next. Now, we went through what we have done up to date, and where are we now? Right now, we're currently finalizing the project development for the first 3 schools. And remind you, to refresh your memory, is Pierce Middle, Alexander Elementary, and Little High School. For this, ACOM is developing Tier 1, Tier 2, and Tier 3 preliminary plans and cost estimate along with the feasibility report. All these tasks are expected to be finalized by mid-April about. The county is also planning to implement Tier 1 improvements this coming summer. And the county is currently pursuing funding for Tier 2 and Tier 3 improvements. What's next? Since we now have established guide, the county is going to repeat this process with the next schools and the prioritized list. And you can see which are they come in pairs. So the first school is the primary, and the second one is the secondary, or now named tag along because already has its primary. And they are King High and Robles Elementary, Guider High and Claydale Elementary, and Brandon High and Limona Elementary. Now I would like to kind of trigger your memory and see if anybody remembers the quote I mentioned at the beginning. I shared with you at the beginning. By show of hands, anybody remembers? No? Okay, I'll mention it again just to remind you. The future is not something we enter. The future is something we create. At Hillsborough County, with this quote, I just like to let you know that, just share that at Hillsborough County, we are creating a safer future for our students today. We're creating it today, and we need your help. It is going to take an enormous effort from the entire community to get us there. And lastly, I like to conclude the presentation with another quote, this time from Mahatma Gandhi. And it says, the future depends on what we do in the present. And I think wonderful things are being done, and we are carving a beautiful future, a very bright future. With this, I just like to open for, questions.
Any questions for Diana? Thank you, Diana. That was very nice.
You're welcome.
So that Tier 1, the constructions will be complete by fiscal year 21. So that's July then, right?
It's there is since it's minor things like payment markings, things like that. The county has set aside some funding for that, and is scheduled to be done before the school year opens in August of 2021. Okay. That's the plan.
Alrighty.
Okay.
All right. Thank you very much.
It's a pleasure.
Again, Diana.
It was a pleasure presenting. Okay. Bye.
All right,
Thanks,
Wade.
Let me just change the presenter.
Yeah.
And I'm not sure that we have the presenter for this item here, but it is an interesting item, and I happen to have the presentation, which I saw earlier. So with your permission, Mr. Chair, I'm happy to walk the group through it a little bit.
Yes, let's go ahead and walk through. So is it Mr. Majdalawi?
Excuse me. Yes. Majdalawi, Maj. But unfortunately couldn't be here tonight, I guess. But it is a really cool product, and I've seen these installed in Jacksonville. Is I believe the only place I've seen them, and on a very curvy, but otherwise low speed and you would think low risk road, but these make a huge difference at night, and I've seen them on crosswalks. They're also associated with rapid flashing beacons, which seemed like a good combination. So this is just going through when crashes are and what the causes are, and that this product could help with some of those. So distracted driving, inclement weather, and of course many of the things that we know about, that the speed, that your circle of vision shrinks as your speed increases. I'm sorry, I'm just trying to get towards the meat of this. These are FDOT approved, and MUTCD compliance is the main purpose there. But just to see what they might look like, these really do help, and it doesn't take that much light at night to really just light up that crosswalk is there from a distance, which really helps drivers out. So you can see a couple of applications here, and those white ones, in addition to helping that crosswalk stand out, they're pretty attractive as well. This is a couple more applications. Somebody pushing an RRFB, and you can see that. So just there are different colors, which we've heard some stuff about that in relation to RRFBs, and I think that that is, I think we all do know that red means stop, and I think it's helpful that these can come in different colors for different applications. Just another example on a crosswalk there, and then they can change to green, which sure helps a lot too. So just looking at the average cost range, they talk about these applications being both the timing and the cost, $42,000, $30,000, depending on the, or $7,000 just for nighttime only, and a very quick installation. So another application highlighted bike lanes, which I think we can all agree helping see those lines is great, as well as pathways, even in the middle of just multi-use paths to provide a center line there directionally. Just a couple more delineation applications here if you had a grade change or something. This appears to be changing from reflectors to then having the lights, which I think is certainly more visible. An application here, wrong way prevention. So you would have red lights facing if it were a wrong way driver. Also, these vertical curbs, particularly where you have turns, we do see a lot of crashes or people hitting them when they're distracted or don't see them at night. You can see that there were actually poles in the bottom left, and well, all of these, there were originally vertical poles there that are gone. Speed bumps, and here's the product, which is what I was really trying to get to. It does just go into a inch and a half deep depression in the asphalt, 2 and 5 year warranties on that. So I'm not sure how that matches up to other products, but glad FDOT is supporting that, and it seems, as they say, durable even for snowplows. And reduce, apparently on the turnpike they're using them as well. So a big reduction in crashes there. Bunch of references and support, and apparently they can install them very quickly and retrofit existing systems. So here's how they do it. looks like they're taking a chunk out, drilling, and then somebody's coming back at the back end, cleaning it out, and then the third person is putting it in and getting it at the right level, and I'm sure the person at the end there is cleaning it up with some asphalt around it and sealing it all down. So anyway, I'm not sure that I can answer any questions on that, but I do think it's a great type of product. I can't speak to this one specifically other than what you've seen in the presentation. But I would certainly like to see more of this around here, and it looks like a reasonably cost-effective way to look at some of these crossings and other applications. So thanks.
All right, any questions or comments by the group?
Wade, I had a question. I know you said you can't really answer many questions on this, but do you know how this cost compares to other types of, flashing crosswalks and things like that? You said it was fairly cost effective, so.
Yes, they have a chart in there that showed the cost of each. 1 second. Excuse me. There we go. So here they show rapid flashing beacons, mid-block crosswalk solution for 2-lane roadways, comparisons and delivery time. So highlighted crosswalks nighttime only would be $7,000 compared to, but to update an RRFB, according to them, costs more than an RRFB. So I'm not sure what that's, I thought rapid flashing beacons were actually more expensive than that, but maybe I'm thinking of Hawks, which are more in the 250 to 300,000 range. Hawks, just to remind everybody, are like the new ones on Bush Boulevard that are the overhead flashing red lights that are more like a full stop signal rather than rapid flashing beacons. So I guess I'm not so sure about the. Oh, they're including the cost of a hybrid rapid flashing beacon plus in-road lighting. So I guess they're saying that's $12,000.
Okay.
But they could do, I guess I'm a little confused about how some of these numbers add up because my math seems a little different than theirs.
Okay, thank you.
Thanks, Alan.
And I think in the chat box, Alex, we piloted these in MLK Boulevard in West Tampa at the crosswalk near St. Joe's Hospital. Are you able to speak a little bit more about that pilot and length and success factors and so on?
Yeah, absolutely. This is Alex Henry, FDT staff. So we were asked by our leadership in kind of in the spirit of spurring technology and innovation to look for locations to pilot this technology somewhere on the state highway system. And we selected the existing crosswalk on MLK right in front of St. Joe's Hospital. I think it's between like Armenia and Havana. I'd have to get the exact location. But those have probably been in a couple years now. I'd have to check with our traffic operations office to see if they've done any before and after evaluation. Given that it was done in conjunction with rectangular rapid flashing beacons, RFBs typically have pretty high yielding rates standalone, often in the upper 90s as it is. But yeah, I don't know offhand any before and after data that's been collected, but I also haven't heard any concerns with maintenance either, which I know is one of the main concerns we had when we did install them. And it looks like Richard also indicated in the chat that there were potentially some at another location that had to be removed because of a maintenance issue. But I can definitely circle back around with our safety folks and see if they have any data on any effectiveness of them.
All right, wonderful. Any other comments or questions for the great or good? All right, moving along here, Flamingo Fairs update with Linda.
Okay, good afternoon, Mr. Chair, members of the committee. Can you hear me okay?
Yes, we can.
Okay, excellent. Linda Crescentini, Interim Chief Financial Officer and Director of the Project Management Office with the Hillsborough Transit Authority. And I'm here to give you a quick overview of the Flamingo Fairs projects, where we are today and what's coming up with the implementation. Next, please. So with that said, the overview is going to also consider the Flamingo Fair system, the benefits, the features, the distribution networks that we have, the support system, the timelines, just a super high level of the project expenses, the available functionality by phase, our reporting Tableau Dashboard, and our Title VI compliance, as well as upcoming marketing and communication outreach to the public. Next, please. So what is Flamingo? Flamingo is the brand name for the regional fare collection system. It's an electronic fare payment system, which is basically smart technology, which is an account-based system. It has the contactless smart card to the left, as well as the mobile application and future integration with Apple Pay, Google Pay, and all of that. But the balance is actually in the back office and not necessarily on the card or on your mobile phone. Next, please. So what's available today? The Flamingo app is available for download. We have not reached necessarily out with marketing, and that I'll expand on that a little later. But you can have a free download from Flamingo's Fair for either Google Play or from the Apple Store. And currently we have available in our customer service centers the Flamingo card, which is a one-time cost for $3 for the new card, as well as replacement cards. Next, please. Where is Flamingo installed? So it's a regional effort. It's installed in Hernando on the bus. It's obviously installed at Hart. It's installed at Pasco, PCPT, as well as Pinellas, PSTA, and the Jolly Trolley, and also in Sarasota with SCAP. Next, please. So what are the benefits? We have fare capping, pay as you go. So a lot of times our underserved community can't afford a monthly pass, and they actually wind up spending more if they're paying daily than someone that can afford a monthly pass at the discounted rate. So with this, as long as you have the card or the mobile app, whichever you choose, and you have you use the card and you've had the card registered, then you will cap out at $65 a month, no matter how much you ride. So it gets you through about day 18 if you're a consistent rider and riding 7 days a week, at which time you will never pay more than $65. It also caps you out on $4 a day, and that's in Hillsborough. Pinellas is $5 a day. And so if you're transferring or you're riding more than 2 times, you will only pay $4 that day. So the one card and application is used throughout the region, like we discussed. There are discounted fares for those who qualify. It would be the same process that you would go through our customer service area and produce the documentation that you need for the reduced fares. And once you're in the system, you will only pay that discounted rate. It also comes with balance protection. So like I mentioned, it's an account-based system. So the balance is not on your card, the balance is in the account. So whether you lose your phone, you buy a new phone, you need to transfer the information, or you lose your card, your balance will always be protected. And then for us, it helps with faster boarding time. So the taps or the scans are extremely faster than it is for someone using cash. And in the day of COVID, right now it's contactless. So no money is exchanging hands, and there's less of an interaction. So it's a little bit safer from that perspective. Next, please. So Hart had to have some fare structure changes. We have our current fare structure, which we went back to the board in December of last year. And both fare structures are running concurrent for the next 6 months from now until July 1st. And what we were able to do is we were able to streamline our fare structure, because it's no longer that it's this pass or it's that pass. It's actually just you're loading funds onto the card, and you use them as you see fit or needed. So it's more, like I mentioned a couple of times, the account-based system than it is that you're buying passes. We also had to go back to the board for the $3 card fee, which they approved, and we had to go back for fare capping. Fare capping helps our customers. It does cut into our revenue streams, but we feel that's critical for the community that we serve. When you do go online, whether you go to the mobile app, or we'll talk in a little bit about retail stores, there is a minimum load of $5, and I'll get into that in a little bit. Next, please. So the discounted fare, just like I had mentioned, if you do qualify, right now it's a little more complicated because our discounted riders have to produce an ID, they have to produce cash or a ticket. In this case, when they come into our customer service area, their pictures will be placed on the back of the card, and they only need the card or their mobile app, and they'll be able to just use one form of identification for both their payment and for their validation that they're able to use a discounted fare. Next, please. So where can you purchase currently? You can purchase the cards in the transit center. The Flamingo app is up and operational. We're getting a lot of downloads. We will have institutional corporate portals, and those are for, say, for example, the universities. If University of South Florida, we're working with them. They upload, I don't know, 50, 60,000 students during their semesters. They will be able to manage their own accounts, so they can add people, subtract people as they need to. It's not something that needs to be managed by heart. Any other institutional website, whether it's someone, social services, but the schools are probably the largest customers. And also the Flamingo customer website is up and operational, and the retail network. Right now we're doing our field integration testing. Excuse me. So that will be up very shortly. We have an RVR system, which you can, similar to a banking RVR system, you can call in, you can check your balance. For someone that doesn't necessarily use the website or the mobile app, they'll be able to see their most recent visits. They'll be able to see how much of their balance is left. And it's a regular IVR system that walks you through the steps and options. Next, please. This project touches everybody within the agency. So we have our operations center, the tech, our IT department, project management office. We have the regional working group, which is our partners that I mentioned earlier. We have our external vendor, which is in it, as well as finance plays a huge part into this because of the reconciliation that needs to happen at the end of each month. Our marketing team is coming on board, and we also have technical expertise that have guided other agencies across the United States to kind of give us a jump start on lessons learned, so we're not recreating the wheel. Next, please. So with that, I get this question a lot: why is it taking so long? So a typical project of this size takes 3 to 5 years. If you look at where we were, we actually went live the week before COVID. We did all our revenue testing and our integration testing through February of last year. We were ready to go live, and things kind of came to a halt. So with that said, the system, which has kind of been beneficial for us because the system has been up and operational in the background this entire time. It allowed our team to go through a learning process without being inundated. So that's been helpful. the complexity of our group is that each of our sister agencies has their own fare structure. So all those rules and financial reconciliation accounts had to be set up in the background, and that's why it's taken us a little longer than just someone like Michigan, who's a single entity, and they were able to complete it in 3 years. Next, please. So with that said, it's a $12 million project. Currently, we've spent up to just a little under 9 million. And this kind of tells you how our funding came in. So it's mostly federal, state, some direct payment with Hart ad valorem. PSTR, our biggest partner, stepped up in the beginning, and we kind of split the cost 50-50, little less than 50-50. T-BARTA, because it is a regional, it does have, you know, a regional ability to it, as well as expanding to future opportunities. They saw the benefit and they also contributed. Next, please. So where are we? We had talked a little bit about what is up and operational right now. The smart cards are, as far as, the web portal, the institutional web portal will be a little bit later. All the base components are up and operational. PayPal, ACH is, as well as, like I mentioned earlier, the IVR. What's out in the far out column, which will be completed by later this year, probably around the November timeframe, will be the open payment, and that's for your Apple Watch or Google Pay. We had to create a new banking opportunity with Chase. Taking MasterCard and Visa has new security issues with it, so we modified from the base that we are looking at to a much more secure payment method. So that is going to take a little bit of design and testing, but should be up and operational by the end of the year. Next, please. You might have to click this a couple of times. So the Tableau Dashboard gives us awesome metrics. We can tell where people are using, whether they're using the mobile app, whether they're using the card reader. Yeah, you can bring up that next screen. So it gives us hot points, and that helps also with marketing too. Marketing can target areas that we don't see use at. Maybe it's an educational process that we need to reach out to the community. So with that said, remember, this has all happened behind the scenes. We did not introduce this out. What we did start doing is transitioning our reduced fares as they came in for their new IDs to bring them into the adoption rate. But you'll see in a minute, marketing is going to do a full-blown campaign starting in the next several weeks. Next, please. So with that said, there was big public outreach too, even though it's time of COVID and it's hard to meet with people one-on-one, but we wanted to make sure that we are compliant with Title VI. And it's an education process. People don't know what Flamingo is. There's a lot of people that are unbanked. There's a lot of people that might not have access to smart technology. So there is a huge educational process going on behind the scenes, also public engagement with our folks that, you know, we have a lot of institutions, whether it's a battered women's shelter or someone else that uses our system and usually buys cards that we manage for them. In this case, they'll be able to manage their own. So the comments that had come back, we took those in, analyzed them, and incorporated the concerns or comments that they had at the time. Next, please. So marketing is going to be underway. We have some really cool stuff coming out right now. Like I said, over the next 6 months, it's more of an educational process. We have some cool bus wraps, as well as reaching out to folks to really drive home the fare capping and what a good program that can be for folks that are transit dependent It's for anybody, but folks that are transit dependent that just can't afford a monthly pass, that they can benefit just as much going day to day as folks that can afford the monthly pass. And next, please. I think that's it. So I'm here for any questions or comments you might have.
Thank you, Linda. Any questions or comments for Linda? All righty. I think we saw some commercials on it already, right?
They're starting.
Yeah,
They are. They're going to be reaching out a lot more now.
All right. Well, thank you very much again.
Sure.
Right. So next is Allie with the Department of Health, right?
Yes, sir. Allie, would you like me to pull your presentation up or make you the presenter?
I can try presenting. Why don't we see how that goes?
All right. 1 second.
Okay, show my screen. Okay, can you see my PowerPoint?
Sure can.
Okay, wonderful. And I lost it. Hang on. Wait, it might be better if you present for me then. And I'll just let you know into advance.
Sure, just 1 second.
Okay. Okay, awesome, thank you. So I am going to speak today about our community health assessment and our community health improvement planning. Next slide, please. And the next slide, thank you. And this is our community health assessment process we do every 5 years. It's required for public health accreditation, so you'll probably notice when you go to a doctor's office or a hospital that there are accreditations for those organizations, and so local public health departments around the country are accredited as well. We are unique in Florida in that we are integrated, and our state and local health departments are accredited as one. So not all health departments around the country have yet applied for this. We participate in this, and it shows that we meet certain standards in public health performance. So our community health assessment is part of this, conducted every 5 years. We use these results to develop what's called a community health improvement plan, which helps provide direction for our efforts. Certainly we have other programs and services, and this focuses more that population health level interventions that we do. And we utilize a model that comes from the National Association of County and City Health Officials called MAP. And so you see that little roadmap in the corner. Just kind of walks you through all these different stages of 4 different assessments that are part of this, where we gather data from the community, we use secondary data, we assess the local public health system, so what other players and stakeholders there are in the local public health system besides the health department, so groups like the MPO, hospitals, schools, fire, EMT, and then we also are looking at what forces of change occur in our community. So COVID, for example, would be a force of change, or a hurricane could be a force of change, a change in political administration. So there can be positive or negative impacts from these forces of change. We look at that as well when we set the priorities. Next slide, please, Wade. So we did our primary data collection for the 2019 process from February through June 2019. We had over 5,000 survey respondents, which is one of our highest response rates yet for our county. We interviewed 25 key informants, and so that includes leaders in our community, such as from Healthy Start and from our federally qualified health centers and from some of our hospital systems, so individuals who interact with the public health. community and can weigh in on, what are the specific needs of their clients and customers who they serve related to health. And then we also conducted focus groups with community members. Next slide, please. So this is a list of some of the secondary data resources that were used. We drew heavily from Florida Health Charts that has information from a variety of health sources such as ACA, Behavioral Risk Factor Surveillance System, looking at things like hospitalization rates, causes of death, infant mortality rates, a number of indicators for health and chronic disease, and then as well as U.S. Census and other community resources. I will point out that we use the ALICE report, which is from United Way and identifies different characteristics for community members who are asset limited, income constrained, and employed. And so that's relevant when we get into what our high need zip codes are. So we'll come back to that in a minute. If you could advance, please, Lee. Thank you. So our priority setting happened in July of 2019. We had over 150 attendees, so individuals from the MPO, from our hospitals, from our Healthy Start, from the Coalition of Community Gardens, from a number of different community-based organizations, as well as general community members participated. We presented the survey results as well as the secondary data, conducted the forces of change that day, where we brainstormed what those different forces might be in the community, and from there identified what the top community health priorities were. Next slide, please. And so this, in rank order, is our top 10 health issues. You'll notice that behavioral health, access to care, and exercise, weight, and nutrition were the top 3. That is where we generally focus our community health improvement plan, is on the top 3 issues. You'll see that immunization and infectious disease is number 7 on this list, keeping in mind that this was almost a year, 6 months to a year before COVID really kind of emerged in the United States and really took hold. So certainly if we were doing this assessment today, that might rank very differently than it did in the past CHA cycle or in cycles before that. Next slide, please. So I mentioned the ALICE report. This comes into play with looking at households that make above the poverty line but below the median income, and the median income in Hillsborough County is around $55,000 to $56,000 for a family of 4. So in our high need zip codes, more than 60% of households have $50,000 or less in annual income. So more than 60% are either in the ALICE community or in what we would consider low income or in the poverty, below the poverty line. So we identified these as 7 different areas where there is a disproportionate burden of households that have $50,000 or less compared to the county, where it's 42% of households have $50,000 or less. So I'm going to just highlight a few different indicators that we looked at across these 7 zip codes. Next slide, please. So the first is transportation, and you'll see that the bar on the right actually reports on the county as a whole. And so in these tiny zip codes, public transportation is easy to get to, all rated higher than the county. And so this, you could say that this has to do with more access to public transportation in areas where there is more need for public transportation. Also potentially just a reliance on public transportation in these communities that, I live in Brandon, I drive most places. There are some places I can walk and bike to. There is public transit. Would I say it's easy to get to? I don't know necessarily. I don't take public transportation on a regular basis. So it might be very easy to get to, but it may just be a case of perception or a regular use that people don't necessarily identify that public transportation is accessible if they're not needing to access it, as a lot of our use is needs driven. Next slide, please. So walkability in these communities, in these 7 high need zip codes, did rank lower than the county overall. In some cases, not by much. In others, almost half. So certainly, you know, sidewalks are very important for walkability. We didn't assess things like crosswalks or stop signs or what, you know, whether people were walking on main roads or side roads. When we were asking this question, was just about sidewalks in general, that sidewalks were present for the areas that they were walking in. Next slide, please. And then in these high need zip codes, food insecurity was much higher compared to the county overall. And so certainly we know that issues like walkability and transportation access can impact ability to access food. Food insecurity, looking at whether someone has, you know, regular access to a food source, not necessarily fast food being a food source, but reliable, you know, way to have food, sufficient food for their family. And so certainly this information was before the pandemic, and as you can probably imagine, and as we've seen in our programs at the health department, food insecurity has really continued to be an issue and has increased in our community as a result of COVID-19. Next slide, please. So in 2020, we did a follow-up with additional key informants, so asking some of those same individuals, you know, how COVID-19 has impacted the communities who they serve, and the top health issues, again, were access to healthcare, were mental health and mental disorders, and then food insecurity were the top 3 issues. So just reiterating that those needs continue to be you know, a problem in our community, and continue to be the priorities for community health in Hillsborough County. Next slide, please. And so right now, as part of this community health improvement planning process, we are continuing to implement our action plans. With access to health services, we are working with the Family Healthcare Foundation and other organizations to increase training for navigators. So individuals who help enroll people into health insurance plans. So that could be the county health plan, the federal exchange, such as now during the special open enrollment period. This can also include Medicaid, Medicare, and CHIP for children. With behavioral health, we're working with 3 other counties, with Pasco, Pinellas, and Polk, with their health departments and the not-for-profit hospitals in their communities, on implementing mental health first aid, which, as it sounds, is a first aid type intervention for mental health, so identifying when someone might be in a mental health crisis and trying to help get them to resources or connect them with services before the situation escalates. And then with exercise, weight, and nutrition, our focus has been on food insecurity, on screening clients at the health department for food insecurity using a standard 2-question tool that comes from the U.S. Department of Agriculture to identify who may be experiencing food insecurity, and then we're working to help refer them to resources in the community, so pantries, the SNAP application, and many of our clients who are participating in this program are currently receiving WIC benefits as well. And the next slide, please. I think that's it. So our CHA and our CHIP are online and can be readily accessed and downloaded. If you have questions, I am happy to answer them now, or myself or my colleague Griselle are available by email as well.
All right. Thank you, Allie. Any questions for Allie here? All righty. Thank you very much again.
Thank you.
All righty. All righty. I think that was that was it for the presentations. Moving on to old and new business here. We have an item here with the National Bike Summit, and I think that was with Mr. Shirk. Is that correct?
Yes, sir.
Yeah. Can you hear me?
Yes.
Can you hear me?
Hey, Jim.
Hey, hi guys. Yeah, National Bike Summit was last week, and it was a pretty significant event because it was completely at virtual. Everything was online. We had the biggest showing of Florida people at the summit that I've ever seen. Obviously, because we didn't have to pay to get there or pay to stay there or pay to eat and drink there. So it was pretty easy. But the most interesting presentation is the one that I sent a link to Wade Reynolds for the talk by Charles Brown, professor of planning at Rutgers. And basically he's talking about the need for equity as opposed to enforcement in the 5 E's. Because as we all know, the communities of color, African American, and Hispanic are disproportionately impacted by pedestrian and cyclist deaths. Seems like everything is stacked against the communities of color. And Charles Brown has an interesting and very provocative discussion on substituting, or well, the title of his talk is Arrested Mobility, and he talks about the fact that for people of color, their mobility has been arrested essentially by not only just by the planning situation, which undervalues them, but also the lack of consideration in planning for the disproportionate enforcement activities that are taken against particularly bicyclists. One of his examples is, as you would probably expect, is biking while black in Tampa. During the period 2003 to 2015, over 10,000 traffic tickets were issued in Tampa, and 79% of those were issued to black people, whereas the city population is only 30% black. So that tells you that there's a real imbalance there. Wade, were you able to, it looks like you're able to pull up the link to the video.
Yes, Jim, this is the video. I did not know if there was it looks like it's about an hour long. Is there any particular point that I might skip to?
No, actually, I highly recommend that if you're in the planning business, or if you're interested in the planning business, that you go look at it, because it's pretty powerful and impactful, and it's something that we who are interested in planning and interested in bike safety really need to bear in mind, because there's a reluctance in the black community to involve themselves with this, because frankly they don't think they're being listened to or heard. So if you're in the plan, if you're in planning, particularly if you're in safety planning, I would highly recommend you review that video. Charles Brown's email is charlesbrown@equitableCities.com. Equitable Cities is one word. And once you've seen it, if you have any questions, you can reach out to him, and I think he'd be more than happy to help you out. Anyway, that's all I'm trying to pass on.
Alrighty, thanks, Jim. And I see we have a link to this video in the chat box, and I imagine that will also be made part of the minutes as well.
Yes, sir.
Alrighty. Any other new business or revisit some old business here? All right. One question I have is does it look like the county building will be open in April timeframe? April, May?
Not for typical public business, but we could, if there are basically 11 people who so desire, we can be in a room with plexiglass dividers and all the other things that we've discussed before.
Okay.
So I'm happy to send out a doodle poll. It does look like we have only three people still actively interested in our 3 open positions. So it would be great to take action on that, and of course action on officers. And thank you again, Jonathan, for sticking around.
Alrighty.
Okay.
Alrighty.
I will send out a doodle poll just to try and get see if we can get 11 people, and maybe we can do that next month.
Alrighty. All right. Thank you, Wade. All right. If there's no other new or old business here, I think we can go ahead and end the meeting and adjourn for the evening. All right. I'm
Thanks,
not hearing any.
all.
All right. It's good to see everybody, and
Okay.
we'll talk next month. Okay. Okay. Take care.